Okay, so before I start my cardiovascular and peripheral vascular video, I'm going to scan my room at 360. And my camera is in the selfie mode. Okay. 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 Knock, knock. Hi, Kyle. My name is Princess, and I'm a student of United States University. And today I am going to do a cardiovascular and peripheral vascular assessment on you. Before we start, I need your consent to video this assessment and put it on YouTube as unlisted so that my professor will be able to view. So do you give me consent to record this video?
Yes.
Okay, can you verify your name? You can give me your initials and your birthday for me.
KT, August 26, 2006.
Okay, so before I will start this assessment, I'm going to wash my hands and sanitize. And first of all, I will check blood pressure on both arms, in supine and sitting upright. And then I will be assessing the patient JVD. Okay, so Kayo, I am standing on the patient right side. So I will ask you to turn to the left for me. Okay. So now I am assessing and inspecting the site, and I don't see any trails. Okay, and I am going to measure the highest pulsation right now. Okay, so I am going to look for it, and I can see it right there. So I will have a ruler and some sharp edge and measure it. Okay. Okay, so I will put it on the sternum of the patient, and I'm going to measure the highest pulsation. Okay, so with my patient, it is 1 centimeter, and which is normal. So below 3 centimeters is normal. And then I am going to palpate for any bruit. Okay, Kayo, I am going to palpate. Okay, your distinct corradic pulses on both sides. I will do one at a time. Okay. Okay, so pulse is regular and +2. There is no bounding or thready pulse. And can you turn to your right side for me? Okay. And on the right side also, I don't see any trails, and I'm going to palpate the coratic pulse. Okay, so pulse is regular and +2. There is no bounding or thready pulse, so it is normal. Then I am going to, before that, of course, you will put the head of the bed 30 to 45 degrees to check the JVD. Okay, so I am going to assess this sternum, and it is symmetrical. Chest is rising symmetrical, and there is no signs of distress. I don't see any visible masses, no lesion. I don't see any apical pulsation. I don't see any precordial pulsation. No visible precordial pulsation and no visible apical pulsation. And now I am going to palpate for the point of maximal index. Okay, I don't see, and the point of maximal index is in the midline of the clavicular in the fifth intercostal space of the patient. Okay, so I don't see any visible pulsation, so I'm going to palpate. There is no I'm going to palpate. Okay, so I can which is in the left side of the patient in the fifth intercostal space. Okay, I can palpate some brick tapping here, which is normal. And normally, if you can't palpate, you ask the patient to lay on your left side so that you can palpate it well. So Kayo, can you lay on your left side for me? Come closer to me a little bit. So if you can't palpate when the patient is laying down, you can palpate it when the patient is laying on the left side, and you can hear it better. Okay, lay back for me. Now the next step is palpation. Okay, so I am going to palpate the aortic valve, pulmonic, Ebbs point, tricuspid, and the mitral valve. Okay, and the aortic valve is in the second intercostal space in the right side. Okay, I'm going to palpate. Okay. Okay, and I'm going to palpate the pulmonic in the second intercostal space. And the Ebbs point is in the third intercostal space on the left side. Pulmonic is in the second intercostal space on the left side. And the tricuspid is in the between the fourth and the fifth intercostal space on the left side. And the mitral valve is in the fifth intercostal space on the left side in the mid-clavicular, where the point of maximal impulses. Okay, so it is regular. It is regular. I don't feel any there is no no trills, there is no heaves, okay, or no lifts as well. I'm going to accostate right now, and I'm going to use both the diaphragm and the bell to like accostate the heart cell. Okay, so I am going to start at the aortic, which is the right second intercostal space. Okay, and I'm going to start with the diaphragm, and I'm going to accostate the pulmonic in the left intercostal space, in the left side, in the second intercostal space on the left side. And I'm going to accostate the Ebbs point, which is the third intercostal space on the left side. And I'm going to accostate the tricuspid in the fourth intercostal space on the left side. And I'm going to accostate the mitral valve in the fifth intercostal space on the left side. So S1 and S2 noted, no brill, no trills, no lifts, and no heaves. And I'm going to accostate the same thing with the bell as well. So this is aortic in the second intercostal space on the left side, pulmonic in the second intercostal space on the left side, Herpes point in the third intercostal space on the left side, tricuspid in the fourth intercostal space on the left side, and also the mitral in the fifth intercostal space on the left side. And I don't hear any bruit, no murmurs. Heart sound is regular, S1 and S2 noted in both. So now I am going to also listen to the splitting of the S2. And S2 is heard in the aortic and the pulmonic. So it is best heard if, on inspiration. So it is heard if the aortic and the pulmonic closes unevenly. Okay, so Kayo, I will ask you to take your deep breath and I will listen. Okay, so I'll do that with the diaphragm and the bell. Take a deep breath out. That is the aortic in the second intercostal space on the right side. And this is pulmonic in the second intercostal space on the left side. So can you take a deep breath and out? And I will do the same with the bell. Okay, which no splitting, no S2 splitting was noted. Okay, so now I am going to palpate for the aorta. Okay, so I will inspect the aorta. I don't see any visible pulsation. Okay, I don't see any bulgy. I don't see skin is clear and intact. Okay, Kayo, I am going to palpate. Okay. Okay. So it's like regular. Okay, and it's like less than 2 centimeters, which is normal. Okay. Do you have any tenderness in that place?
No.
Okay. So now I am going to do my peripheral vascular assessment. Okay. Before that, I will listen to my aorta with both the diaphragm and the bell. To listen to any bruit, turbulence. Okay. That's with the diaphragm. I'm going to listen with the bell. Okay, so there is no bruit or turbulence noted. It's regular. Okay, and since the patient, for like privacy sake, I'll be also palpating for the femoral pulses and listening with my bell and the diaphragm. Okay, I'm just going to. So since I'm not going to ask the patient to remove his trousers, so I'm going to palpate on top of that for like like educational purposes. Okay. Before that, you will inspect and make sure you don't see any visible pulsation there, no like bulging and no mass. Okay, so pulse is regular and +2, and I will listen with my diaphragm and this in the telescope. Okay, so I would have listened for any bruit, like a whooshing sound, but like there is nothing, and with the bell as well. Okay. So there is no bruit or turbulence noted, and pulse is regular and +2. Okay, now I am going to move on to the peripheral to check the upper extremities and the lower extremities. So I'm looking at the upper extremities, okay, and I don't see any swelling, no lesion, no masses, no visible masses. Okay, skin color is normal to ethnicity, and I'm going to palpate both. Okay, skin is warm and dry. Okay, and there is no edema, no pitting edema. Okay, so I am going to check for the radial pulses. Okay, so I will check both arms. So pulse is regular and +2. Okay, and I'm going to check the radial pulses as well. So pulse is regular and +2. There's no bounding or threading. The pulse is not bounding or threading. It's regular and +2. Okay. And now I am going to check for capillary refills in both hands. Okay. So all the fingers. We'll be checking. Okay. Sorry. Okay, so my capillary refill is less than 2 seconds, and I'll be checking for clubbing too, and I don't see any clubbing. Normally, if like there is clubbing, that means the patient have COPD or emphysema, any heart-related issues. So now I am going to move to the lower extremities. So since patient has his trousers on, we are not going to remove it for like educational purposes. So I would have assessed the skin, and skin is clear, no visible masses, no lesion, okay, and no scars, okay. And I'm going to palpate, no swelling, and I'll palpate for edema. There is no edema, and there is no pitting edema as well. And skin is warm and dry, okay. And I'll be checking for capillary refills in both toes. In both fingers, both toes, all the 10 toes. Okay, so we'll check. Yeah, normally you do one at a time. So capillary refill is less than 2 seconds, and it's normal. Okay. And now I'm going to check for pulses. So I'm going to check in both bilaterally. Okay, so I will start with the puppital on the right. Okay, can you just bend a little? It's okay. Check for pulses. Normally I will do it without the trousers on. Okay, so I will say pulses regular and +2. Okay, and I'm going to check the other leg, which is the left, and this is the puppital. Okay, and pulse is regular and +2. Okay, and I'm going to check for the posterior tibialis. Okay, and I will do it bilaterally too. So it's regular and +2. And I'm going to check the dorsal pedalis. Okay, pulses. So this is the dorsal tibialis. Okay. Oh no, this is the dorsalis pedis. This is the dorsalis pedis, and it's regular. Okay, dorsalis pedis, and it's regular and +2. Okay, and that concludes my assessment for the cardiovascular and peripheral vascular assessment. Thank you, and thank you, Kayo. You can get that.